All right, so on the left side of your screen, we can see the thyroid gland. And let me get that back into the appropriate view here. Let's zoom back in. But there you can see the thyroid gland highlighted here. I made it a blue color on the left side of your screen. So let's jump to the right side of your screen and let's take a look at the histology of the thyroid gland. So you can see all these little pools, and these pools, I don't know if I can select them, I can't select them, but you can see under the histology, there's like these little pools, and I could do a little drawing here. Let me do a little bit of drawing. So here, these are thyroid follicles. So all these little pools here are thyroid follicles. And these are the pools are made out of colloid. And what's going on there? Well, that's where the thyroid hormones are going to be made and stored. So remember our thyroid hormones, T3 and T4, that's where they're going to be made and stored. You can see around the outside, we have the follicular cells around the outside here. I can't, but you can see making up the outside of the follicle. All right, now let's go to the next part here, and let's find the pancreas. So we're up here with the thyroid gland here now, but let's find the pancreas. So here's the pancreas, and now it'll load up the slide for the pancreas. And you'll notice with the pancreas, so here's a histology slide, and it's already got it selected for you, but the majority of the pancreas is actually dedicated to exocrine function. So for the digestive tract, creating the pancreatic enzymes and pancreatic juices, which includes buffers. Um, but you'll see in the tissue here, these small patches, these small white patches, which we call those pancreatic islets or islets of Langerhans. Um, and so that's why there's an L here for islets of Langerhans. These are the pancreatic islets, or also known as the islets of Langerhans. So as you can see here, right there is a pancreatic islet or an isolate of Langerhans. All right, so this is the endocrine part of the pancreas. So the majority of the pancreas is dedicated for digestive function, but then these small white patches in the pancreas that we see on when we stain the tissue here and look at the histology, this is dedicated to the endocrine system. So what is going on in the islets of Langerhans or the pancreatic islets? Well, that's where we have our alpha and beta cells. And remember, our alpha cells, those are going to produce glucagon. And remember, glucagon is going to be produced when glucose is gone, and glucagon is going to increase blood glucose levels. And then we have the alpha cells, and then we have the beta cells. The beta cells are also within the pancreatic islets. Remember, the beta cells, they're going to produce insulin. And what does insulin do? Well, insulin is going to decrease blood glucose levels. It's going to open up the lock to open up the door so that glucose can actually go into the cell and go into the cells. And depend, it could be muscle cells, and other cells of our body, of course. Um, all right, so now let's go to preset number 6. Let me load that up. All right, so now we're looking at preset number 6 here, and we want to look at the anterior pituitary, and we still have our histology up. So there's the anterior pituitary. I need to load up the histology real quick again. So there you can see, I've clicked on the anterior pituitary right there. So I've got that selected. You can kind of see the posterior pituitary. It's hard to click though. So I'm just gonna go with the anterior pituitary here because there will be some slides. I will find them back here. So this is a great slide here, and you can see that there's a G and an N. So if you look at the right side of your screen, there's a G and an N under this histology slide. What does the G stand for? Well, G means glandular tissue, and then the N means neural tissue. So remember we said that the posterior pituitary is known as the neural hypophysis because it's made out of neural tissue. And then the anterior pituitary, remember we said it's actually producing those six anterior pituitary hormones, so it's made out of glandular tissue. But remember the posterior pituitary is not even, it's not creating the posterior pituitary's hormones, ADH and oxytocin. It is just storing them and then secreting them. But remember, the posterior pituitary hormones are made up in the hypothalamus. So you can see the glandular tissue stains darker, and then the neural tissue stains lighter here. So the where the G is, that is the anterior pituitary. Where the N is, that is the posterior pituitary. And you can see a clear delineation between the two of them.